Meow! Huples cat. Becky Girl's here and Mr. Bear's over there. Right now I'm in quarantine. Not because I have the disease, not because I think I might have the disease, but because I'm now of the mindset that I'm in phase 4 of my pandemic plan. I think I have the disease and I don't want to pass it to anybody, and I think anybody else I meet might have the disease and they might pass it to me. That being said, I'll still be walking the dogs but taking extra precautions, and I'll still be going to and from work. But as of now, I'm in phase 4 of my pandemic plan. So I'm going to go through this. It's from Canada Health. It actually tells normies how to prepare. Kind of an interesting document. Before I do that, I just want to give you a roundup on March 15th about what's been going on. First off, traffic is visibly light outside and people aren't going out, and they're not going to go out for a few months now from this point. Cases have risen quite dramatically in Ontario and Canada, and specifically in the GTA, the Greater Toronto Area. We do have admitted patients at hospital. I don't go back to work until Wednesday, and for that I'm eternally grateful. The hospital's now decided that if you are putting on a face shield or gloves or a mask, you should keep them on. Well, duh. No, I mean keep them on for the rest of the shift. In other words, we're that short of essential personal protective equipment, and we haven't had a major surge yet. This is an absolute disgrace, but that's the way it is. Like I said, get a whole bunch of trash bags. You might run out of gowns in your hospital, your healthcare work, and trash bags make a good disposable gown. You might want to get swim goggles. Can't really rely you'll have face shields and goggles at work for too much longer. And if you've got PPE, if you've got N95s, you might want to start figuring out how you personally are going to reuse them. I'd much rather reuse one than have none. And then not using a surgical mask in a Covid-19 ventilated patient's room. I'm sorry, I'm not. I know the hospitals can do everything it can to keep N95s going for specific uses like intubation and for swabbing. I'm fairly sure, unless they're insane, they're going to make sure that the ICU nurses with ventilated patients and the respiratory therapists and the doctors with ventilated patients will have them. My main concern is the emergency department. They really should all be in N95s now and should be staying in them, but of course we don't have enough. Back in late February of 2003, I was teaching for George Brown, and we had a meeting and we were talking about what we were going to do with this new disease that was floating around called SARS. And I actually told them all, sorry, the semester's done. All the hospitals are going to shut to all students, it's done, and it's going to go on for months. We've lost this semester and we better start planning for it right now. And we did. And for our program in George Brown, it worked out quite well. I actually made quite a bit of cash out of it afterwards. But anyway, long story short, we have now suspended all clinical placements unless you have already been trained. So in other words, if you're at the hospital doing a master's program or a research program, come on down. But if you're a student nurse or a student respiratory therapist or a student occupational therapist, you're banned. Now, I'm not quite sure if we're going to ban student doctors. I do hope so, because they're as easily likely to infect themselves and other people as a student nurse, but we still in 2020 seem to think doctors are special. They're not. So if you're a healthcare professional, my advice now is to get moleskin and figure out where to put the moleskin on your face if you're going to have to be sealed into a mask for a 12-hour or a 16-hour shift. This is bad. The amount of planning for this and the amount of money spent on this pandemic planning by the hospital, by the health authority, by the country for the last decade is massive, and they have failed utterly to prepare us. Still a few people floating around who think it's just the flu. It's not. Anyway, the other thing is I did the video yesterday and I hope you all watch it. I meant it, and I meant every single word of it. The negative feedback from that video is that I'm going to get murdered and raped, and so are my dogs, and all my stuff's going to get stolen. I think people haven't quite got the ability to adapt to circumstances. This is a very specific type of SHTF. At no point am I telling my neighbours I have stuff. At no point am I telling my neighbours that I'm a prepper. And in terms of having them accessing my house, that would be under specific circumstances, and only some of the specific neighbours would have the key access. But I think it's a huge error to allow psychotic paranoia to mean that you end up one day in your house with massive amounts of food and water and guns and ammo, and you and your family can't get out of bed and your kids die because you can't feed them and give them water. Or you can't get home because of the roadblocks and your animals die because they have no water. Or because you're absolutely psychotic and you see this as the end of the world and everybody in the world other than you and your friends and family are dangerous. It's just simply not true. Yes, we are not seeing the finest of us right now, but we are seeing the finest of us right now. In the countries badly affected, people are rallying around and helping each other out. It's the only way to survive a pandemic that messes up the healthcare system and every aspect of government. Get that into your heads right now. Get a support network. Get ready to help. The other negative was like putting myself at risk from going into people's homes if they're sick and nursing them. I don't think they realised what I do or what Kitty does as a job. Frankly, that's no risk to us, any more risk than anything else we're doing in our actual paid jobs. I'm not asking people without training and skills and equipment to go into people's house and nurse them, but it might come to that. And certainly if you've been watching my videos and other people's videos, you should feel fairly confident, right? Wearing improvised PPE, going into a home and giving people water who've got the disease. If you're not confident to do that, you don't have the PPE and you need to seal yourself in your home and never leave. Seriously. This isn't something that a few people are going to have and you can easily avoid it and pretend it doesn't exist. This is something many people will have, probably the majority of the population, and you are going to be in contact with it by surfaces, by breathing, by touching bull terriers. So the other update is Kitty's at the Shire with the mom and visiting her sister because her sister needed a morale boost and they needed to get away. And the risk of that is zero. They didn't have to stop en route because we have a Prius and they won't have to refill the car and they're going to be very sensible when they're down there. And to be frank with you, I think it's more important at this point in time that the three of them get together and have some fun, because I don't know if we're going to have a lot of getting together time and having fun in the near future. They also found 2 dogs, cue picture, and I was really excited. I was hoping to get those dogs and replace them for the 2 we have, but unfortunately we have found their owners. They've been missing since Wednesday. So they'd actually been missing for 5 days. These dogs were emaciated and terrified, but they're very sweet and loving. So we have found the owners, and the owners have collected them and were crying and are so pleased. They were actually going to get hunting dogs in to try and find them. Well-loved dogs. Anyway, that's a happy story. So I will of course put the link up for this, and it's kind of fun. It's in certain sections: outbreak update, which is now out of date, well, you know. Symptoms and treatment, prevention and risks, being prepared for health professionals, Canada response and travel advice. So you can actually look at this stuff, and it's from the government of Canada. Yeah, Justin Trudeau is busy in his bunker. Anyway, it's actually worth getting stuff like this. I did do one video on Norway's preparedness document that they did last year. All this stuff is useful, especially if you're a prepper and you think you know everything. It's worth fact checking yourself, and it's pretty smart. So I'm just going to read it out to you. It's going to be a dull video. I might put up some pictures of those dogs again, actually, because they're really cute. And I might even put up some pictures of the Shire, which I haven't really been talking about. It's an off-grid solar passive home we're having built. And then the idea is we'll sell this one and move there and retire. Well, we may be working longer and we may have trouble selling this until the market recovers. Such is life. It talks about still being China as the epicenter. As we know, China's claiming that they've beaten the disease. Again, when they lighten up the restrictions, what I want to see is in 3 weeks, 4 weeks time, will it resume? That's the key thing for that. But China, by draconian and aggressive measures, has actually ceased transmission. And once its transmission has ceased and people recover, they can then not infect others. We hope. Some countries may not have the capacity to detect or contain the disease. This is true. The United States of America did not. Nor did Canada, nor did Italy, nor did France, nor did the United Kingdom, etc, etc, etc. Again, this is propaganda from the government. We can contain this. Well, we haven't, have we? While the risk to Canadians is still low, it's important to be prepared at both the individual and community level for possible scenarios. We are well equipped to contain people from abroad. Absolutely we are. We're ready to shift our approach quickly if need be, from containment to slowing the spread. So that's the way you do it. First off, you have to recognise the infection, and that took a bit of time with this one. what it actually was and what we should be doing, then you contain people you think might have it or do have it so they don't infect others. Once that fails, you then mitigate the spread. You try and slow the spread, flatten the curve. I'm sure everybody's an epidemiologist now. That won't work either in this particular disease, in my opinion, just my opinion. The only thing that will work in this disease is stopping people touching each other in close proximity for a period of time. That's the only way it's worked in Singapore, Taiwan and China. Everyone has a role to play. They do. It takes more than governments and action from the health sector to protect the health and safety of Canadians. Each of us can help our country be prepared in the event of an emergency by understanding how it spreads and how to prevent illness. True. This is a war. Each of us is responsible not to get infected and to make sure if we are infected or might be infected, we can't pass it along. We have to take this as seriously as if Russia had invaded Seattle. I'm serious. This is serious. You have to think ahead. Absolutely. Now, and always during cold symptoms, stay home if you feel sick. Absolutely. Could the government please fully fund people for that and make it easy to call sick? That would be great. We've actually suspended requirement for sick notes, I believe. Ridiculous. Little green sick notes in the doctor you have to pay cash for to prove you're actually ill. So immediately straight to bad advice. These are spread through contact. Yes, they're also spread through air droplets when people sneeze, etc. So instead of a handshake or kiss or a hug, no tongues, a friendly wave, yes, or elbow bump is less likely to expose you to respiratory virus. Yes, an elbow bump is less likely. However, you are within a metre or within a yard of somebody, stop with the foot greetings and the elbow bumps, please. Too close. Stay your distance, don't talk too much. Make sure they don't, if they do sneeze, it won't project at you, and be friendly, verbally and by waving. So make a plan, absolutely make a plan. If COVID-19 becomes common in your community, you will want to have thought through how to change your behaviours and routines to reduce the infection. Disagree, before it becomes common in your community, do this now. Once there's common caseloads in your community and you know it's in your community or you know it's in a town near you, it's already spreading around your own town. Okay? So seriously, make these behaviours changes now, especially if you have no cases in your city or your home or your town or your country. Make the changes now. It will spread there. Do your grocery shopping at off-peak hours. Absolutely, and make sure to buy every piece of toilet roll you can. Canada and Australia make toilet roll. I believe the United States does. We're not going to run out of toilet roll. Sadly, the people making the toilet roll are making a ton of overtime, and then they're going to get laid off because nobody's going to want to buy toilet roll for a while. Commute by public transit outside of the busy rush hour. Excellent advice. Not sure how that works in the Greater Toronto area, as rush hour is about 4 hours long anyway, and that's not going to work. So again, something like wearing an N95 and washing your hands before and after travel is probably really smart. And if I was using transit, I'd be doing that now. Opt to exercise outdoors instead of an indoor fitness class. Well, most of them in the GTA have shut down. People are too scared to go, and the instructors are too scared to do the classes. So that's kind of a voluntary thing. And if you're going to do outdoor activities, don't think about doing road races and stuff like that. You are in far too much proximity of people breathing hard. Solitary exercise, man. That's what we're doing now. You should also plan what to do if you become sick. Absolutely. If you are the caregiver of children or other dependents, you will want to give a thought ahead to engage backup caregivers. Absolutely. Listen to me on this. Absolutely. However, most people are car dependent in our society. Most people cannot envision that they cannot get gasoline because nobody's going to work to pump it for them. Try and make sure it's local as it can be. Your redundancies have to be compromised. If you have a really great person that can help you out and you have dependents, perhaps move them into your home now or move the dependents there now. Don't wait for lockdown before you do this. This is the time to act. You should also think about what to do if a member of the family becomes sick and needs health care. Well, you call 911, right? Send them to the hospital. That's what we do with our unwanted old people. Oh, apparently not. Talk to your employer about working from home. I've talked to them about working from home and they told me I can't. If you need to care for a family member, they've told me I'm essential, I have to go in, no matter what. And actually, if it gets bad, they'd probably send the police around to drag me in. I'm not kidding, they probably would. Stay home until you no longer have symptoms. Absolutely. Great advice. I would say stay home for at least 48 hours after you've last had any symptoms at all, but that's just me, and that's just based upon actual epidemiology. But we don't have enough people, right? Your plan should include shopping for supplies. Absolutely. You have to have at least 12 years worth of toilet roll, and you should have it hand at all times. Interestingly, GTA are running out of frozen and fresh meat and frozen vegetables and canned food. People are really going full prepper on this one. It's a pity they haven't been doing it for a while, but they haven't. Food will be available throughout the pandemic. You'll have to line up to get it. You'll only be able to get it at certain times from certain places, and the food will be very limited, and expect the prices to rise by at least 30 to 50% over what they are today, right now, in the stores, at a minimum. You should build on the kits you've already prepared. Of course you should. Everybody should have a 72-hour kit. They keep telling you this and nobody listens, right? Most crazy preppers. For information, go to getprepared.ca. This is important. Fill your prescriptions. Refill your prescriptions now, so you don't have to go busy pharmacy to become sick. Consider seeing your healthcare provider to renew your prescriptions ahead of time. Absolutely. You should always have 3 months supply of any prescription med, and in this case if you can get up to 6 months or 9 months, do it. It's possible. Stock up on essentials, but avoid panic buying. I guess people haven't read this. Okay, so fill your cupboards that you have with non-perishable food items so you don't have to go shopping if you're in quarantine. No, you don't want to go shopping, period, from now on. All of these trips people are making out to the markets, to go to the big box stores to say, look at all the toilet rolls not here. Stop doing it. Stock up on everything now and stop unnecessary trips out. And going shopping is unnecessary. It is unnecessary. You are exposing yourself to infection. You are exposing the people around you to get infection from you if you have it. Stop it. Break the chain of infection. It talks about gradually building up food and stuff like that. Well, obviously that failed because people think, oh my goodness, look at Italy, look at Spain, look at France, and look at Germany, and people are freaking out. I don't blame them. It tells you actually, I love this, get dried pasta and sauce, prepared canned soups, canned vegetables and beans. That's right, you don't need to buy canned meat. Vegan strong. It was also a good idea to get extra stores of the following. Pet food, which I prophesize will be the next item that actually runs out. I think a lot of pet food is actually made in China. These guys, I think it's made by vegan chefs somewhere in Alberta. Toilet paper, facial tissue. Toilet paper, isn't it? Feminine hygiene products. Now, I have not panic bought any feminine hygiene products, but you might want to think about it. And diapers if you have children who use them, and also if you have adults that use them, okay? Get a good 3-month supply of hard goods in, stock it up. If you've got a small apartment, be creative, put it behind sofas, put it underneath tables, be creative. So this is great. The reason for this is not necessarily because you will need to self-isolate. Having these supplies on hand will ensure you do not need to leave your home at the peak of the outbreak or if you become ill. What Canada Health isn't saying is stores might be shut for a period of a week or two and you may not be able to get any food. It's entirely possible that the supply chains will break, not because of no supplies of anything, but because truckers and warehouse workers and store people may well not come to work for a period of time. Canada, Ontario has plans to keep the water flowing, keep chlorinating the water and keeping the hydro on. They have definite plans in a pandemic to deal with that. I'm not particularly worried about that. If you live rural, your lights might go off, but they go off anyway, so you should be okay with that. So be very careful what you're doing in terms of reading documents like this. What they're trying to say is, we might not be able to feed you. When you dial in 911 and going on Facebook saying, I'm trapped on the 20th floor of my condo in Toronto because I'm a wheelchair person and the power's been out for 3 days, nobody might come. No fire service might come, no ambulance might come, no neighbours might. You need network now. You need to redeploy, bug out now if you are dependent to an area, to a place with people who are part of your network that will help you. Do not rely on the healthcare services, the police, the fire and the ambulance. In a massive surge pandemic, they will be unavailable. They will be too busy or too sick. How to care for those who are ill? How do you care for people who are sick? I don't know. If you or a member of your family become ill with Covid-19, there are precautions that should be taken in the house. Your healthcare provider will advise you if hospital care is more appropriate. Yeah, if you can get hold of them. Refer to the guidance for health professionals when caring for someone in a hospital setting. So what you need is soap, absolutely, facial tissue, alcohol. There's not really a lot of snot with this. What there is a lot of with this one is other things. If you're getting a lot of green phlegm and green snot, you've probably got a bacterial infection. And if you have COVID-19 bad enough to put you in bed and you get a bacterial infection and you can't get access to an IV or somebody to force water on you on a frequent basis, or antibiotics specific for bacterial infections, you've got a really good chance of dying. Just so you know. Alcohol-based hand sanitizer, of course, we have to get them. Paper towels. Now, I'm not really keen on paper towels because they're not really great for the environment and you're going to get a lot of waste. So you're assuming that the curbside garbage will be working every week. It may not. What I would actually do is have a lot of hand towels or even cut up old sheets and use them as single use and then wash them. That would be much more effective. And remember, when you're drying your hands, pat your hands, don't rub it, though that's arguable. Household cleaning products, well, there are none left, so you're out of luck. White vinegar's great and stuff like that for basic cleaning. You want to keep the dust down, you want to wipe any bacteria or any virus off the surfaces. If you want to do a full isolation clean of your surfaces, you want to use something like bleach or a antiviral wipe. You might need them, you might not need them. General cleanliness is probably going to be preferable. Remember, you should not be coming in and out of the home, and nor should other people, right? So the need for virusing out the home and all the rest of it is zero unless people are coming in and out of the home. Regular detergents for washing dishes and doing laundry. Yeah. And what you might want to do is you might want to start reducing the amounts you're using now. People use far too much of all of this stuff. Fever reducing medications such as acetaminophen, which is Tylenol or paracetamol in the United Kingdom, or ibuprofen, Advil. Now the French are suggesting that Advil is bad for people with COVID-19, that it has a worse outcome. Who knows? I don't know. I don't care. I don't use Advil anyway. There's a suggestion, and again, this is not strong clinically based, but there's a suggestion Advil in people over the age of 40, specifically male, can have adverse reactions to that. And I don't really like Advil, I don't think it works very well, and I still recommending aspirin and Tylenol. Up to you, pays your money, takes your choice. This includes products for children if you are a parent or caregiver. Yeah, it does. Plastic garbage bags for containing soil tissues and other waste. Yeah, just remember you might get a lot of them. And you also need those garbage bags as gowns if you're nursing somebody who's sick in the home. Single-use gowns, garbage bags work great. And if you're a healthcare provider, make sure you have 400 or 500 of them at home so you can take them to work and use them if you run out of gowns at work. It can happen. Household bleach for creating a solution of 1 part bleach to 9 parts water to disinfect the surfaces. Absolutely. I'll put a little clip up of Frank Z spraying his bathroom.
So we're going to do the knobs on the cabinets and stuff, and the light switch. So fan. Switch. Just make sure everything's nice and clean. That'd be alright.
You can tell it's a pandemic when I watch a 16-minute video on cleaning a bathroom. It was a good video. Get reliable information. Absolutely. Watch my channel. Public Health Agency of Canada is reliable. If you are finding that the news media is making you anxious, take a break from it. Totally. Do you need to live in the now? No. Communicate with your friends, families and neighbours. Let your friends, families and neighbours know that you're making plans to prepare for this. Share your plan with them, as this might motivate them to make their own. Talk to them about a buddy system in which you agree to check on each other and run essential errands if you become sick. Yeah, that's an essential. It's essential to do that before everybody gets sick. The community, social distancing. Stay home when ill during the peak of the outbreak. Minimise contact during the peak of the outbreak. Do not spread it. Some of the social distancing measures need extensive preparation, especially where large crowds are concerned. Now, I think right now there's going to be no large crowds anywhere anyway, so this is kind of rubbish. What you need to plan for: interruption in social supports, reduction in public services like transit and access to community centres. All hours are shut. All our community centres are shut. Financial consequences from reduction of service or cancelled events. Yeah. A lot of bankruptcies. Planners need to do all the rest of it, blah blah blah. Schools and daycare, simple, like separate the desks, all of that sort of stuff, to more extensive like closures. I think pretty much every school now is closed. If it's not closed, you want to wonder why it isn't and not send your kids there anyway. There's going to be economic costs. Sensible countries have provided 24/7 daycare for healthcare workers with kids so they can go to work. Stupid countries like Canada and America are not planning to do that because they're stupid. Family first if you're a healthcare provider. If you've got a 2-year-old kid and nobody can look after that kid, do not go to work. It's your work's fault. They should provide a creche for you for this. Take personal measures, communicate to the teachers, blah, blah, blah. Now this is important for everywhere, not just for schools but for your home. Regularly cleaning and disinfecting high-touch surfaces and objects like door handles, toilets and toys, and cell phones, and TV remote controls and light switches. Again, Frank Z shows that. Good video. Postpone events, divide classes, etc. So for workplaces, it tells you what to do in workplaces. Close common areas, separate people, put a physical barrier like a cubicle or plexiglass window. Hygiene, this is what, you know, it's basic stuff, and I think it's really, really important. And it talks about business travel should only be if essential. Good luck getting a flight anywhere. Talks about using email, teleconferencing, all of that stuff. Don't rely on your employer to figure this stuff out, especially if it's a small employer. Have a good think about how you can be an effective, good worker from home, and come to them with the plan. Come to them with an idea about how to replace essential workers. Like in my place of work, when I called sick last time in January with flu, I was replaced by 4 people. I had the head of emergency planning, the head of patient flow, a patient flow specialist, this is 5 people actually, an educator from the ICU, and an extra emerge patient associate. 5 people had to come in for all or part of the shift because I wasn't at work. And because my work is very isolated, I only work nights and I run everything, and to explain it is really difficult, but to do it is very hard. So think about that. So I hope you enjoyed this video. My dogs did. They're both fast asleep. They will wake up and start barking soon. And think about this. You right now should be COVID-19 prepared. If you're not, think about why you're not. There's people out there to this day who still believe this is a hoax, or it's been overblown and it's not much of any. They're considering that there could be 7.9 million deaths in the United Kingdom over this disease. That's the government of the United Kingdom that are saying that. We don't know how many are going to die. We do know that the economy is going to be smashed for months. We do know that people will die. So break the chain of infection. Do not get infected, and if you can't do that, make sure you're not infecting other people. Assume you're infected. Assume they're infected. So that's it from me. Remember, in SHTF, tomorrow will always be worse than today unless you prep. And for a pandemic, tomorrow will always be worse than today until the virus decides it's had enough of us. Toodles. This has been a 2020 Bad Terrier production.